Webinar today is about a new initiative that has been in the planning stages for the past year, and it'll be moving forward with a little more publicity as we end 2020 and go into 2021. And it's called Human Capacity and Community Transformation. So we thought this was a good opportunity to give a little preview about what is coming and also let you know where we are in this process. Up to this point, it's been kind of operating under wraps, not in secrecy, but it's been happening in planning rooms and primarily with the national partners, your state associations, your state CSBG offices have all been involved, and some of our local CAAs have also been participating in some of the planning. But we want to start sharing with the network and letting you know what this initiative is and the opportunity that we think it provides for community action. So our agenda today is pretty straightforward. We're going to start off defining and describing what HCCT is. We're going to talk about the values and principles that underlie it. I think you'll find that the values and principles of this initiative are really the values and principles of community action, and really what you'll ultimately, I hope, see is that HCCT is nothing new or different. It's just an opportunity to really shine a spotlight on what community action is all about, and so you'll see that in the values and principles. We'll talk about the focus areas of this initiative, kind of what the idea of it is and how it's going to work going forward. And then we're going to finish up by talking a little bit about how you can be involved. And there are a lot of ways to participate in this initiative, particularly as we go into the fall and into 2021. So you will be among the first to have the chance to think about how you can be part of this network-wide initiative. But let's start at the beginning and identify just what is this HCCT initiative. So it's a national initiative that is funded by the Department of Health and Human Services, the Office of Community Services. That's the federal office that funds community action through the Community Services Block Grant. Of course, our network gets funded in a lot of different ways, but that core CSBG funding comes from OCS. And so HCCT is also rooted in the Office of Community Services. And that sort of should be an indication of how central it is and how this initiative is meant to really be a unique branding opportunity for us in community action. The initiative began almost a year ago in October of 2019. It's operating on a 3-year time frame. And we are concluding the end of year 1, which has been designated a planning year. And then we'll have 2 more years to operate. And so the formal HCCT initiative is set to conclude in September of 2022. Some of the key stakeholders in this initiative are the Regional Performance Innovation Consortia, the RPICs. So you hopefully have had some interaction with your RPIC. That's the group of state associations in your region of the country that's been working together for several years now to collaborate in providing training and technical assistance. So a lot of the RPICs have regional conferences and provide support directly to local agencies and state associations, much as the partnership does nationwide. Also, our state associations are very important strategic partners in this. They've all been engaged in planning and helping define what this initiative looks like, what it could become as we move forward. So your state association has been a very critical partner in HCCT. State CSBG offices have also been a significant partner for very much the same reason. They also know a lot about what's going on within each state and how this vision of HCCT can kind of strengthen the network from a state office perspective. And then, of course, our national partners, the Community Action Partnership, NASCASP, CAPLAW, and NCAF, the National Community Action Foundation. And last but not least, I almost forgot our National Roma Trainer Association. All of those national partners have also been active participants during this planning year. And as I've said already, the easiest way to think of HCCT is to think of it as a showcase for community action and for CSBG. Because we know that CSBG doesn't necessarily fund all the work that we do, or even in a lot of cases, it doesn't even fund a majority of the work that we do. But CSBG is that critical identifying funding stream for community action. It's ours. And it's that funding that we can use to innovate and pilot strategies, develop new programs, meet unmet needs. And so this initiative is really an opportunity to show how we use resources like CSBG to engage in human capacity building, supporting our families, supporting their potential, helping them achieve goals, as well as community transformation, which is really the big picture of what community action is all about. So be a little more specific about what it is we're looking to do through this initiative. Our goal in HCCT is to discover the high impact work that agencies have already been doing. Okay, so that's an important thing. This isn't about running off and doing something new just because the federal government says, hey, maybe we should do different things. HCCT recognizes that community action already knows what works. We know how to transform our communities. And across our network, we've been doing it for years. And so what we want to do is look across the entire community action network and pick out where are the really great examples, the really high impact examples that show how community action has created stronger families, more resilient and supportive communities. So we hope that by the end of fiscal year 2022, we'll have been able to demonstrate what we're hoping is over 100 different strategies and initiatives that have already been proven throughout our network to be effective and that can then be replicated in communities all over the country. The key thing that HCCT wants to emphasize is that in order for community action to work, we need to have strong community action agencies everywhere. So you might remember a few years ago, or you might not. Now that I remember, it was probably about 10 years ago. President Obama talked about cutting the community services block grant in half and only putting resources into the highest performing community action agencies. And we fought that as a network. And we fought it not because we just wanted to keep our money or keep our agencies open. We fought it because of the principle that every community in America deserves a strong community action agency to support the most vulnerable in that community. And so HCCT isn't just about pointing to the best and saying, look at how good they are. That's part of it. But it's also about looking all across our network and saying, how can we all strengthen one another, work together, and build our capacity as a network so that every community can do that really high impact work? Because every community deserves community change being led by community action, because we do it with the community. So that's what I meant earlier when I talked about how I think this HCCT initiative is really nothing new. It's just a spotlight for community action to really stand forward and do what we've always been doing. And so if you look at the values and principles associated with this initiative, and these core values and guiding principles, these are actually spelled out by the Office of Community Services when they developed the request for grant proposals and the contracts and all the paperwork that goes with a grant. These core values and guiding principles are in those documents. And if you think about them, they're really the core values and guiding principles of community action: dignity, the role of community as being a stakeholder in supporting every individual, the importance of work and responsibility, the idea that our work should have impact. I think those core values are central to what we've done for years. And the guiding principles, which you can really think of as, how do we live those values? What does it look like to live those core values? It means sustainable independence, that people can live free, or to the degree that it's possible, free of government supports, and be able to pursue their goals independently rather than being dependent on a service provider or a government agency or something else. We would support employment as well as individual empowerment. Government has a role. Government is a catalyst. Government should be supporting and encouraging these efforts. Community matters. So the community should be engaged in our work. Evidence-based policy, which, of course, that's what we do. We don't just make stuff up. We learn what works, and then we do more of what works because we have data that shows that it works. And then, of course, a guiding principle for community action from the beginning: the individual and family-centric design. So these are the formal values and principles of HCCT, but they really shouldn't come as any surprise or lead anyone to feel like we have to bend community action into some different shape or different value system, because these are our values, and this is an opportunity to show them in action. Now, some of you may have heard a little bit about HCCT through the grapevine, because anytime an initiative like this is introduced, it sometimes brings up incorrect ideas about what's going on and what we're trying to do. So let me tell you what it is and what it isn't. As I've said already, it is an opportunity to highlight and replicate the great work that's being done in the network. And there's a lot of that work. So it's not going to be able to highlight everything that's being done, but we do want to identify at least one really high impact initiative in every state so that we can show that the work is being done in every corner of the country. And HCCT is a continuation of our previous work with the organizational standards. You might remember that for the past several years, the Community Action Partnership was also sort of went by another name as the Org Standards Center of Excellence. And so we kind of helped support the strengthening of the org standards across the network. Well, HCCT is sort of the heir to that legacy. The organizational standards are in place. We're living by them, and the vast majority of our agencies are knocking them out of the park in terms of meeting all of the org standards. HCCT is about saying, let's keep going. Let's move past the organizational standards. Let's talk about excellence. Let's talk about a model of community action that is, years ahead of where we are right now, and making sure that we all can be along for that ride. So that's what HCCT is. Now, what it is not, because there's been some concern about this, it is not a new reporting or compliance requirement. So some of you may have completed Module 3 in your annual report where you talked about a community transformation initiative. Those types of initiatives might be excellent candidates to be highlighted initiatives in HCCT. But those are conceptually very different things. Module 3 is about capturing information so that we can share that with Congress. HCCT is about us. It's about us identifying what is powerful and what we want to learn from one another. So forget about other people's requirements. HCCT is all ours. It's also not a requirement to change what you're currently doing. HCCT does not say, because of this initiative, you now have to change all of your agency's programs and services, and you have to just throw yourself into community transformation, whatever that is. Your programs and services are already transforming the community, and in some ways, it's transformation by keeping people from falling behind. So that's critical, and HCCT does not say stop doing that. And there's also not a requirement that says you need to do something new. If you are partnering with public sector stakeholders, if you've got good relationships with funders, if you're engaging the community, you're at a lot of community tables and really advancing resiliency and equity and self-sufficiency in your community, HCCT says keep going and tell the rest of us how we can do more of that. So it's not a requirement that you have to develop some brand new initiative. It's really just an opportunity to sort of look around and appreciate all of the great things that our network is doing, and then steal a few good ideas. And the great thing is we're going to facilitate the stealing because we're going to give you as much information as we can about those initiatives so that you can implement them in your community. Now, HCCT has two broad focus areas, and I've already alluded to these, but let me be very clear about just how important they are. One of them is highlighting effective initiatives. Okay, so you can think of these as sort of two pillars that HCCT is built on. Our network is going to find the best, most high impact community change efforts that are currently in operation in the Community Action Network. We're going to understand how they work, and we're going to share information about them with everyone. Tools, resources, templates, communications materials, you name it. That's a big part of HCCT. What is going on that's really good and really effective, and let's share. So if you've got something like that, we're going to be knocking on your door and asking you to tell us how you did that magic, because we want others to be able to do the same thing. The second pillar of HCCT is building our capacity as a network. Because how many of us have gone to a conference or a workshop, or maybe just talked to a colleague at another community action agency and had that moment where we think, that would be so great if we did that at our agency or in our community. I've got to know what you did. Tell me how you did that. And then you get back to your agency and you sit down with your colleagues, and the no's start showing up. Someone from your program staff says, well, we can't do that because that program's not really funded to do that, and it's not in our work plan. And then your fiscal department says, oh, that's not really an allowable cost, and you'd have to charge that staff time and then things just kind of fall apart. What we're trying to do with HCCT is find ways that we can build our capacity at the agency level, across the network, so that when we identify really good strategies, whether they're strategies to help families or strategies to change communities, that we can all go back to the most powerful, well-organized well-oiled machine of a community action agency, and people can run with it. And so we know not all of our agencies do that. We all have areas, for improvement. Part of HCCT is saying if we want to do some of that really great stuff, what are some of the things we need to do to be better in terms of the work that we do? So building that capacity is a big part of our work. Now, HCCT is two big ideas kind of smushed together in one. There's the HC and the CT. And this graphic that we're sharing now is meant to help show how those two big areas connect. If you think about the individual and family level as sort of the core, that's where we do a lot of our work. That's where it's often easiest to see the change that we bring about in the community. But to have a lot of impact, we want to broaden that circle. We want to serve more families, but then we also want to we want to understand, well, why do so many families come to us for that service? Why do they have that need? So we also want to be able to look upstream and address community level needs and systems level issues that can make our community as a whole stronger. And so again, HCCT is just lifting up the community action model. It says we should be doing family and individual level services and also community change services, and those should speak to each other. So we should be promoting collaboration, not just cross-sector, but also within our agencies, so that folks who are providing direct assistance to families are also connected with our communications team and our policy and advocacy folks and our board, so that we can also be at those tables to change community systems. And a way that you can sort of tie that all together is to think about helping communities thrive, not just survive. And to do that, we need to link the HC and the CT. Now let's talk a little bit more about building capacity, because that's another important pillar of HCCT. We like to think of capacity in the broadest sense possible. Sometimes when we think of capacity, some things come to mind quickly. Do we have money? Do we have people? And those are often the two biggest challenges. Having the money to do what we need to do, and having not just the people, but the right people and the right expertise. But remember that our capacity to drive community change happens all across our agencies. In every corner of our agency, there are different aspects of our capacity. And so this list that we have here is just meant to give you an idea of the range of things that we're talking about. Not just resource development. Obviously, we need more money, but thinking about strategic partnerships, thinking about how we can leverage our community assessment more effectively, doing better strategic planning, thinking of strategic planning not as a one-time project, but as an ongoing lens that we use, so that every day we are strategic planning, rather than referring to some document that someone wrote a couple years ago, and we're not really doing that anymore. So moving these capacity concepts kind of into the next generation, using data in new ways. Talked about fiscal management, board governance. You get the idea. Everything that we do requires some expertise, some resources, some capacity of some form. So if we're going to implement big community transformation strategies, we're going to have to build our capacity significantly. Now, you might be wondering, when am I going to see these HCCT initiatives, or how are you going to decide, what's good enough? Who gets to have their community change initiative occupy the spotlight? Well, that's what we've spent some time this year talking about. as we've been developing some of the plans for this initiative. So here are the criteria that we're using to try to identify initiatives that we think would be good candidates for spotlighting in HCCT. So the criteria that are required are things such as these. They need to have a clear local need identified. So any practitioner of Roma knows you have to start with a clearly identified need. They have to have some role for CSBG, because remember, HCCT is partly about showing just why community action is so powerful, and CSBG is our identity funding. So we want to be able to say, if it weren't for CSBG, we wouldn't have been able to do some key part of this initiative. They have to have a transformative impact. Otherwise, it would just be the HCC initiative. They need to be replicable, because we want to do more of this work. So it's not just about celebrating accomplishments, but it's about copying it and replicating it everywhere possible. We want all of our highlighted initiatives to be evidence-based and data-driven, because we need to be able to show that they really do have the impact that we claim, and the way to do that is through data. They have to use an equity lens. And what we mean by that is that when community action lives its promise, when we say we care about the entire community, we mean it. And so when we engage in community transformation, we always make sure that everyone in the community is included. And so an HCCT initiative would be one that has data that shows that no matter where you're situated in the community, your race, your ethnicity, the language that you speak, this initiative includes you, and you benefit from it. So that equity lens is so central, particularly at this moment that our nation is in. And then finally, of course, we're community action, so customer voice has to be clearly identified in the initiative in some way, hopefully in many ways. And then there are some other criteria that we would like to encourage, but they may not be part of every single initiative that's spotlighted. We think that many of them are going to show a really great use of partnerships and probably involve multiple partnerships. Many of the initiatives we hope will be scalable, which is to say that they would allow an agency to start off small. Like instead of saying, we're going to change the entire community, how about we start on a smaller scale and change this and then scale up? So we're going to have some initiatives that will allow scalability, particularly when maybe you don't have the resources in place to go full scale right from the beginning. We're hoping that they're all clearly sustainable. And so we definitely want to lift up the ones that do have a good track record of being sustainable. And related to that, we're hoping that we have a lot of initiatives that have a good diversity of funding, because those that's usually an indicator of good support from the community, from funders, from stakeholders. So we're hoping that a lot of our initiatives will have one or more of those optional criteria. So now I want to sort of begin to conclude by talking just for a few minutes about what this might mean to you. Because right now, what I've talked about is kind of big picture. We're going to show off our network. We're going to share. You're going to have an opportunity at your agency to learn about what others are doing, maybe to share what you're doing. So let's talk about what that might look like. One thing that we want to emphasize is if you have an initiative that you think might be a good highlighted initiative, just be sure that you're ready to stand in the spotlight, because expect that a lot of your peer agencies across the country are going to be knocking on your door and saying, "Hey, we want to do that." So we'd hope that you would be ready and willing to share data that just would help folks know what to expect in terms of benchmarking their own implementation. And also, how did you do it? So, if you have an initiative that you're not comfortable yet sharing the how did we do it, because maybe it's, I don't know, maybe it hasn't been documented yet, or you're still um, trying to sort of put that story together. You may want to think twice about being a highlighted initiative. On the other hand, this might be a good time to step forward and be highlighted, because this would be an opportunity to say, yeah, how did we do that? Let's put it down. Let's tell our story. We've got a vehicle now to tell the whole country about it. So that would be another way of looking at that. And if it does interest you to participate in a very direct way in terms of maybe sharing something that your agency is doing, or if you just want to be more plugged in terms of, hey, we want to know what's going on. We want to know what other agencies are doing. The best thing to do is make sure that you are well connected to your state association, as well as your RPIC, your regional performance improvement consortium. In some cases, your state association will be the lead for the RPIC. But that's really where a lot of the leadership and a lot of the energy for HCCT is going to be coming from. So, what should be expected over the next few months? What might you see through your email updates from the partnership or from your state association, or if someone from your state association gives you a call, why might they be calling you? Right now, in August and September, we're trying to identify some of those highlighted initiatives. So some of you may have already been contacted about, hey, you might want to you might want to throw your hat into the ring and have your initiative be included in this. Then during the next 2 years, we'll be publicizing those initiatives. We'll be featuring them in conferences, in workshops. We'll be developing tools and resources and sharing those with the network over the next 2 years that this initiative is funded. So that might lead to some inquiries, as I said, other agencies calling you up and saying, we want to do what you did. Hopefully it would lead to some media interest, because here's a local agency that now has a national profile because of the work that it's done. So that's an opportunity. You may be called on to do some presentations, either for your state association, for a region, at one of our national conventions. We really think HCCT is a great opportunity to showcase some of the leaders on the ground in our network, because we know that we have wonderful leadership all across the country. This is another opportunity to show that off. You may be invited to join a peer learning cohort, because we're going to be supporting, not through HCCT necessarily, but through the Learning Communities Resource Center, and through some other initiatives, we'll be supporting opportunities for peer learning. So keep your eyes and ears open for those opportunities. And if you have a highlighted initiative, we may want to just dig a little deeper and learn more about it, so that we can maybe do a write-up as sort of a case study. You may be familiar with the Office of Planning and Research Evaluation. Am I getting that right? OPRE at HHS. I don't know if that's what it stands for, but OPRE is kind of the think tank for HHS. They do these sorts of write-ups all the time. They don't do write-ups on community action all the time. This is our chance to to compete with them and just churn out case study after case study that shows the work that we're doing, and it could really get some attention among policymakers and policy leaders. And I got a that's the end of our presentation. And I just got a question from my colleague about a cost benefit concept. that she's going to have to say more about in order to remind me of what that is, because I have a feeling I'd love to tell you about it. So, Lauren?
Yeah, so I got a question through the chat asking from Carla in Oklahoma. Hi, Carla. Um, about the cost benefit analysis that you sent to her through email. Is that ringing a bell?
It's not. So I apologize to Carla for having a short memory. Carla is one of our RPIC coordinators for Region 6 out of Oklahoma, and she's been very involved in helping with the planning and the convening of her region around HCCT. And I know we've had some exchanges in the past few days, but I'm just not remembering that specific item, and I do apologize. Are there any other questions? Comments?
Carla just sent some more clarification. Let's see. The gist of it is that, if someone were the CEO of a local CA, the cost analysis would be the cost is to a CA is that they will need to use a small amount of staff time to share information about their initiative. And then the benefit would get exposure to the network, to national funders, other philanthropic organizations. Is that ringing a bell now?
Yes.
Okay.
Yes. Thank you, Carla, for hanging in there with me. Appreciate it. So yeah, let me just and Lauren really said a lot of what that exchange was that Carla and I had. And so I'd like to share that exchange with everyone. The idea was, if you're an agency, and goodness knows, with COVID and the economic impact of COVID, and the state of things right now, there's a lot going on. And the idea of taking a staff person or even a team of staff and asking them to take some time to do a little write-up of that partnership we have with the school district and with the public health department, and write that up and get that to to the partnership or to the state association. Is that even feasible right now in this world that we're in? And so the way that Carla and I talked about it in this exchange that we had was that it's kind of a cost benefit analysis. It does take some effort. It does take some time to share knowledge. And so we are asking, if you're an agency that has some expertise and some wisdom to share with the network, we understand that there's a cost to that. It's taking time and staff away from other work that they need to do. But we also want to emphasize that we think there's a benefit. We think there's a benefit to agencies in terms of being able to kind of brag that we have an initiative that has received national recognition, and has been disseminated as a best practice. So that could bring some positive media attention, might bring some more funding support. It might just get some good publicity in the community. Also, there's some benefit for our network, and supporting our network at a time like this is critical. And I know we're all just trying to stay afloat, and keep our communities afloat. But if ever there was a time to look around and see, is someone doing this better? Is someone doing virtual, financial coaching with customers? Is someone doing something with Head Start where they can still have social distancing or physical distancing, but still, have the kids in the center so that parents can work or do something else, during the day? This is a time when we really need to learn from each other. So even though there's some cost to to sharing an initiative, we think the benefit is significant. And so we wanted to encourage everyone to really consider taking on, some of those costs, a little bit of a burden, but also providing a benefit not just to your agency and your community, but to the network. Thank you, Carla, for lifting that up. That was an important point to share with the group. Okay. Any other questions, comments? Okay, well, then we will leave you with some resources. There is an HCCT sort of landing page on the Community Action Partnership website. If you're a local, if you're a state association or an RPIC, we've made some resources available to you, so you should be familiar with these. These are more for you in terms of getting the word out, the TNTA plan template, the messaging toolkit, and the initiative selection criteria. For local agencies, you can also reference those materials for your information. We also have the community assessment update template, which provides a really easy way to do a quick community assessment under COVID. And we have a great fiscal orientation and onboarding series that can really provide a nice overview of community action finances, particularly if you have maybe some new fiscal staff that are learning about the world that we live in, the community action world that we live in, to be clear. This is our webpage for HCCT. It's at the communityactionpartnership.com/HCCT. And as always, you can just reach out to us directly. Myself, my colleagues, Courtney Kohler and Lauren Martin, we are available to answer any questions or provide any support or feedback that you may need about this initiative, how you can partner with us, and how we can partner with you to help strengthen our network and transform our communities. So thank you very much for your time today. If there aren't any more questions, we will close our webinar and wish you well. Thanks so much. Be safe, everyone.